Hello, it's Dr. Minde. Let's continue with histology of the female tract. So we had reached the stage of ovulation, and after ovulation, the follicles, you release the oocyte, and the follicles now form. So follicles become corpus hemorrhagicum because now blood flows into the antrum. Remember, we had an antrum that had fluid. So blood will flow into it, and the follicles will collapse. So that forms cells aligned, breaks, invade the collapsed flow. Therefore, you now have a vascularized corpus luteum. This corpus luteum is born from the anterior pituitary gland. Then corpus luteum has two types of cells. We have granulosa cells, which are large. These contain lipid droplets. Therefore, we call them granulosa cells. They mainly produce progesterone and estrogen. We also have thicker internal cells. These become thicker lutein cells, and they produce androstenedione and progesterone. So those are the two types of cells that are dependent on luteinizing. Granulosa cells now become lutein cells, and so when pregnancy does not occur, corpus luteum now lasts for a few days, and then it degenerates in a process called luteolysis. It's replaced by fibrous connective tissue and becomes corpus albicans. But if pregnancy occurs, corpus luteum is maintained for longer because it's producing the embryo. Until it produces progesterone, then corpus luteum will now degenerate. So then we go to the oviduct or fallopian tube. It has parts. So we have the interstitium that's close to the uterus, then the isthmus, which is the narrowest portion, the ampulla, which is a site of fertilization, and the infundibulum close to the ovaries, and the infundibulum contains the fimbria, which pick up the ovum during ovulation. The oviduct has three layers. You have the mucosa, muscularis externa, and serosa. The mucosa is thrown into folds, and the epithelial lining of the oviduct is simple columnar epithelium. There are two types of cells. We have ciliated and non-ciliated cells. The ciliated cells are the most numerous, especially on the fimbria. Then the non-ciliated cells are also called secretory or PEG cells, and they're have nutritive and protective function. When we go to the muscularis externa, this contains two layers of smooth muscle cells, an inner circular and outer longitudinal. Then we have the serosa that contains simple squamous epithelium and largely connective tissue. What are the functions of the fallopian tube? It receives the ovum through the fimbria, and these are able to direct the ovum into the fallopian tube or oviduct. The oviduct has rhythmic peristaltic contractions as well as cilia, and these transport the ovum towards the uterus. The secretory cells lining the oviduct promote capacitation of the sperm. Remember, capacitation is whereby you remove the glycoprotein coat from the sperm. It occurs in the female reproductive tract, and it lasts 5 to 7 hours. Fertilization occurs at the ampulla of the uterus, the oviduct, and the oviduct also transports the zygote of the fertilized ovum to the uterus for implantation. So the uterus has different parts. There's the conwall, where you have the bilateral horns. There's the corpus uteri, which is the bulk or the body of the uterus. And there's the isthmus, which is the slightly constricted portion below the body. Then you get to the cervix, which is the cylindrical lower portion of the uterus. So from the body, you get the narrow isthmus before you go to the cervix. The cervix has a cervical canal, which is a passage from an internal os to the external os that opens into the vagina. The vagina has fornices, and we call them the fornix uteri, and these are just recessed. Uterus has three layers: an inner endometrium, which is glandular mucosa that is lining the uterus, followed by myometrium, which is smooth muscle cell, and lastly the parametrial layer. So the endometrium is divided into two layers: the stratum functionalis and stratum basalis. Stratum functionalis is the superficial layer. This is the one that degenerates after pregnancy. Then we have stratum basalis, which is the basal layer, and it's able to regenerate. It's the one that remains and is able to degenerate. Stratum functionalis is the one that is shed during menstruation. So the surface epithelium of stratum functionalis is simple columnar, and below the simple columnar epithelium we have a very cellular lamina propria. This endometrium also contains simple coiled branched tubular uterine glands. It contains uterine glands that are simple coiled and branched tubular. The epithelium of the glands is also simple columnar, and it contains both secretory and non-secretory cells. What's the function of the endometrium? You have implantation of the embryo and also forming part of the maternal part of the placenta. Remember, the deciduum basalis is the maternal part of the placenta is towards the deciduum basalis, and then implantation is there on the endometrium on the upper posterior wall of the uterus. Myometrium is divided into 3 layers. Remember, it's formed by smooth muscle cells. You have the stratum submucosum. This is the part of myometrium that's beneath the mucosa. And stratum vascularis, which is the thickest layer of myometrium, and vascularis because it contains many blood vessels. And stratum subserosum is the outermost. Now, the smooth muscle cells in the stratum submucosum are longitudinally arranged, and the stratum vasculosa are circular and obliquely arranged, while in stratum subserosum, the smooth muscle cells are in thin longitudinal bundles. Now, the smooth muscle cells in the myometrium have gap junctions between them, and this facilitates coordinated contractions. We have physiological hyperplasia of the myometrium, where you increase in the cell number, and there's also physiological hypertrophy, where there's increase in size, and this occurs in pregnancy. Hyperplasia is increase in number, hypertrophy is increase in size, and these smooth muscle cells undergo these changes in pregnancy. During pregnancy, the myometrial contraction is usually inhibited by a hormone called relaxin, but during parturition or giving birth, contractility of the smooth muscle cells of the myometrium is increased by oxytocin produced by the hypothalamus and stored in the posterior pituitary gland. So we go to the menstrual cycle. During menstrual cycle, it's the stratum functionalis that undergoes periodic degeneration, and it is usually because of the hormone-sensitive spiral arteries. So the menstrual cycle or uterine cycle has 3 phases. You have the proliferative phase, where the endometrium proliferates and the influence of estrogen from the developing follicle. From there, we have secretory phase. In the secretory phase, the endometrium is still growing. Uterine glands become more tubular, more tortuous, and secretory. They have lots of mucin and glycogen, and this is under the influence of progesterone from corpus luteum. Then, if pregnancy does not occur, ischemia will occur, leading to menstruation or shedding off of this uterine wall that has been building up. So without pregnancy, corpus luteum declines, progesterone is no longer available to continue building the uterine wall, so the stratum functional will degenerate because the vessels, spiral vessels, will undergo vasospasm. So there's no good blood supply, stratum functionalis degenerates, and this leads to menstrual bleeding. So at the end of the bleeding, the endometrium starts to regenerate from the cells of stratum basalis. Then we now start again back to proliferative phase, then secretory phase, then the menstruation phase. The cervix is a channel through which sperms are able to travel from the vagina into the uterus. Through the cervix also, the newborn is able to leave the uterus and to be expelled out of the vagina. Pathogens can also enter the uterus through the cervix, followed by submucosa made up of connective tissue, mostly elastic and blood vessels. Then, Muscularis Externa made up of inner circular and outer longitudinal smooth muscle cell, and lastly serosa made of loose connective tissue. Okay. Then we go to the vagina. It's a highly fibromuscular tube. It also contains 4 layers, mucosa that is thrown into folds or rugae, and the epithelium is stratified squamous parakeratinized. It's moist. We have patches of simple columnar epithelium with goblet cells in between the rugae or the folds. Beneath the mucosa, we have the submucosa containing connective tissue And in the caudal portion, we have the presence of lymphoid nodules for protection or immune role. Then after submucosa, we have muscularis externa with inner circular and outer longitudinal smooth muscle cells. And lastly, the outermost layer is the adventitia, containing dense connective tissue with extensive venous plexus. Thank you.